Welcome to this week's online academy. This week we're continuing our series of specific conditions, and this week we're going to look at seating the client with Parkinson's disease. Now there's going to be 10 questions at the end to achieve your certificate, and if you have any questions please submit them below. So let's get started. Seating the client with Parkinson's. What are the common signs and symptoms? And let's start off with a definition of what is Parkinson's disease. It's a progressive nervous system disorder that affects movement. Symptoms usually start with a barely noticeable tremor in the hand. Tremors are a very common sign of Parkinson's, but the disorder is commonly caused by stiffness and slowness of movement. So there's going to be physical signs, cognitive signs, and psychiatric signs. So what are the early symptoms? First of all, you could notice a tremor. Usually begins in the upper limb, often in the hands and the fingers. There's slowness of movement, which makes simple tasks difficult. Steps may become short and shuffling, and clients may have difficulty getting out of a chair. So clients may have difficulty initiating movement, getting that movement started. Rigidity of muscles and muscle stiffness may occur in any part of the body. There's impaired posture and balance, and therefore an increased risk of falls, and a loss of automatic movements. For example, blinking, arms swing when walking can be a feature. So the later symptoms may include balance problems, again an increased risk of falls. A loss of smell is something that you can actually get quite early on as a sort of sign that Parkinson's may be developing. There can be nerve pain and unpleasant sensations such as burning, coldness or numbness. There may be urinary incontinence, constipation, and hypotension leading to dizziness or blurred vision, especially when getting from sitting to standing or from a lying to standing position. Other symptoms may be dysphagia, excessive sweating, or excessive drooling, or an increased production of saliva. The cognitive and psychiatric symptoms may well be depression and anxiety. They may have slight memory problems with activities that require planning and organisation. In the more advanced cases, dementia, including severe memory loss, personality change, maybe hallucinations and delusions. So what are the challenges in seating someone with Parkinson's disease? And the first one is the rigidity, the difficulty in movement and the difficulty in initiating movement. So for example, they have difficulty getting out of a chair. So one of the solutions may be to use a riser recliner. However, due to difficulty in maintaining an upright posture, they may also need tilt in space with the riser recliner. What we find with the Parkinson's disease clients is that they do maintain independence in walking and mobility for quite a long time, even though they have challenges with mobility. So they want to maintain their independence. So this means that you must provide a chair that's helping to meet their current needs, but also looking to the future. So you may need a riser recliner in the early stages, and maybe later on a chair with forward tilt that just encourages that initiation of movement. However, these clients still need postural support. So you have to get a balance between maintaining independence and providing sufficient postural support and postural stability. Hand function is a problem with the Parkinson's clients because of the tremor, because of rigidity in the muscles. So you need to think about the hand controls that may need to be adapted on the chair in order for the person to be independent in using the chair. So here are some guidance for seating the client with Parkinson's disease. So the general points may be that the clients tend to stay mobile for longer, but have difficulty maintaining an upright posture when seated. So we need to get the balance right between independence and postural control. you need to carry out an individual assessment, but a bespoke chair may not necessarily be essential, but a chair that is easily adaptable to meet their long-term needs will be a feature that you must consider. They can be rapidly progressing. They can move quite quickly to a deteriorating situation. I'm going to demonstrate to you 2 chairs that I feel are the most suitable, just the features and benefits of chairs that would be most suitable for clients with Parkinson's disease. So for the Parkinson's client, I want to demonstrate why a riser recliner is really your starting point, because this client group stay mobile for longer. And they have difficulty in initiating movement. So they have difficulty getting from a sitting position to a standing position. So the use of the riser recliner will help to initiate that movement. So if the recliner is coming up and then with a slight forward tilt, that's going to help them do that initiation to get to a standing position. So when the client is due to stand up, a good tip is to get the heels right behind the knees, to ask the client to slide forward in the chair, and because they have difficulty initiating movement, maybe a rocking movement or counting. So do something like ready, steady, stand, like that. This gets them ready for that standing position. So this rocking movement helps to initiate the stand. On this particular chair, we also have an open angle back, and I think that's very important to provide comfort for the clients. When the clients are in a seated position, they may need head support, they may need lateral support, because although the Parkinson's client does maintain mobility for a longer time, they do need quite a lot of postural support when they sit down. The other thing to remember is that they have difficulty with hand function. So a chair that has larger buttons to maintain, so that they can actually operate the chair independently. When we talk about the specific conditions, we try to highlight the key unique features of that particular client. However, a general seating assessment is necessary. So although there's very specific things that are consistent with Parkinson's clients, you need to do a proper full seating assessment for each client. Now, one of the features of the chair that you need to consider is pressure management, because the clients will probably be sitting for long periods of time. You want to try to reduce shear and friction as well in the chair. So therefore, it's important that you have a back angle recline and tilt in space in order to give them postural stability. Now, you will then find that as the condition deteriorates and progresses, that you will probably move from the riser recliner to a tilt and space chair. And I'm going to demonstrate some features of that right now. So when the client deteriorates and you're moving from the riser recliner chair, you might need to think about using a tilt and space. Because what the tilt and space chair will do for the Parkinson's client, it'll put the centre of gravity behind them, and it will help to reduce them from falling forward. So the tilt and space chair is a really good feature for the Parkinson's client. However, because they may still be mobile or they may be using a stand hoist, it's important that the tilt and space chair comes into a forward tilt. Again, this helps with initiation of movement, and if you are using, for example, a standing aid, that helps to get the person into a standing position. So ensuring that the tilt and space chair comes into a forward tilt is a good feature for the Parkinson's client. When the client sits down, they may need different types of head support, they may need lateral support, and they may even need leg support to keep their feet on the foot plate. So that's the end of this week's online academy. And just to remind you that although we're talking about specific conditions, the general assessment is really the same. And what I want to point out is just what is peculiar or particular to those conditions. So for example, in Parkinson's, it's the initiation of movement, it's the rigidity, it's the tremor. So if you have any questions, please submit them below. And don't forget, we have 10 questions for you to achieve your next level. At Seating Matters, we are here to help you and your patients. So if you have a patient that you feel would benefit from what you learned today, you can set up a person-to-person demonstration or an online demonstration to view our products and put this into practice.